Good afternoon, everyone. Welcome. Thank you so much for joining us. On behalf of the Women's Forum at the Faculty of Health Sciences and Stellenbosch University, I'd like to welcome you all. We are delighted that we can hold this event today, despite all the challenges of COVID, even though it is in a virtual format. I think we've all been very privileged to have a number of men and women working on the front lines throughout this pandemic. And because it's Women's Month, we are going to honor some of these very special women in our faculty. I'm now going to hand over to Professor Sharon Kling, who will introduce the speakers and moderate the question and answer session afterwards. So thank you very much, Sharon, and over to you.
Thank you very much, Kimantri, and thank you to these wonderful women who have agreed to talk today. And we want to celebrate their contribution to the COVID-19 effort at Tygerberg Hospital and Stellenbosch University. I want to thank Kimantri for the opportunity to chair this meeting. And before I introduce the first speaker, I just want to say thank you very much to Kimantri for your leadership, your mentorship, your wonderful example, leading the Women's Forum, and the prolific writing that you have done during this really difficult time, guiding people with ethical principles. So thank you very, very much. So it gives me great pleasure to introduce our first speaker, Dr. Nonte Mhlana. She's a specialist physician in the Department of Internal Medicine, and she's been very involved in the department's response to the COVID-19 pandemic. So we look forward very much, Nonte, to what you're about to say. Thank you very much.
Good afternoon, everybody, and thank you, Prof, for the introduction, and thank you, everybody, for being part of this webinar. My name is Nonte Mhlana, like Prof has said. I currently work at Tygerberg Hospital as a specialist physician, and I've been working in the COVID side for the past 5 months. So I started working at Tygerberg as a specialist on the 1st of April this year, and I've been involved with the pandemic. Or in fighting the pandemic since the beginning. So I'm just going to share some of my experiences. I'm going to speak about the role that I played specifically during the pandemic, some of the challenges that I encountered, as well as some of the lessons that I took from the crisis, as well as the coping mechanisms that helped me throughout the crisis. Just want to share my slide. These are some of our pictures. So like I said, I've been working as a consultant since the beginning of April this year. So what I did essentially as a consultant, I've had to make decisions in terms of patient management, be it the patients that are already in the ward or the new admissions. So I was a team leader. We were divided into 5 teams. So each team had a team leader and plus minus 5 or 6 other team members. So as a team leader and as a consultant, most of the decisions were made by me, but obviously you'd have to take other people's contributions as well, but you have to make the final decision, which is a role that I took very seriously, and I'm grateful for having had that opportunity to be a part of the team. So that was basically what I did in terms of the clinical management. But as a team leader and as a consultant, you don't only do the clinical work. Another role that I took was that of a safety officer, which is basically assisting the infection prevention control department in making sure that the IPC measures were maintained in the ward. So that is basically ensuring that there was social distancing or physical distancing, especially during the ward round, as well as appropriate use of PPE. I thought this was very important because the aim was to minimize staff infections, because that would have a negative impact, obviously, on the team. If one of us gets infected, that would be negative. That would have a negative impact in terms of having staff members having to stay at home for a prolonged period of time, and that would have caused so much anxiety on us as well. So that's what I did. That's what I meant by a safety officer. So these are basically some of the roles that I played as a team leader. I was a safety officer, and another role that I took over was that of assisting with contact tracing of the infected staff members. This was important as well because we needed to make sure that the contacts of the infected staff members were closely followed up and they were screened as well as sent for testing as appropriate. This pandemic and this crisis was not without challenges. I think we can all agree that this has been physically and mentally exhausting for all of us. And in the beginning, there's a lot of fear and anxiety from my side. The fear basically, I mean, I was scared that what would happen if I contract the disease, and knowing that nothing can be done as well. So that was quite scary, and there was a lot of anxiety among staff members as well. So as a team leader, you sort of have to keep checking that people are still okay physically and mentally. They're still okay to carry on working, and sort of suggest available help that can assist with the mental health as well. And another biggest challenge for me was having my family in another province, because I wasn't able to visit them. I wasn't able to get their support, although, I mean, they were still very supportive, but not having them here or not being able to visit them was the biggest challenge for me. And the fact that I wasn't able to see my friends, that was also a challenge. And, although I must say, as painful as that was, I was grateful that I did not have a lot of family burden, for a lack of a better word, in a sense that I didn't have to worry about coming home and infecting family members, especially the elderly members of the family, because they're the vulnerable group. So I was grateful that I did not have that challenge of having to worry about infecting people at home, but it was quite strenuous emotionally not having my family around. I did take quite valuable lessons from the crisis, and what I can mention is that I realized the importance of teamwork. I cannot stress that enough. I mean, without the strong team that I worked with, without the hard work of everybody, and that includes the interns, the students, the registrars, as well as the consultant, without the hard work of everybody, this would not have been possible. So I'm really grateful to have worked with such a strong team. And another lesson that I took from this was the importance of acknowledging your limitations or weaknesses. I mean, this was an illness or a disease that you couldn't even use what you learned during your training, because it was a completely new illness. Nobody knew, nobody knew enough about it. So I realized that it's important to realize when you've reached your limitations and to ask for help. So that helped me a lot as well. And another lesson was that the importance of being flexible. So what I meant by that was being able to, or being open to learning new information and being able to adjust your management of the patient according to what the new evidence says. So that required a lot of flexibility as well. So that was one of the valuable lessons that I got from the crisis as well. So in terms of the coping strategies, I realized the importance of focusing on the positives. I mean, yes, it was stressful. The workload was a lot, and the death toll was a lot as well on our emotional, emotionally. But I realized the importance of focusing on the positive. We did have success stories. So I realized that if I focus on the fact that somebody came in and they were ill and they got better and we were able to discharge them home. So that really uplifted my spirit. So I chose to focus on the positive, meaning seeing a patient getting better. So that was one of the coping strategies that helped me a lot. Emotional support from the colleagues, from junior colleagues and senior colleagues. I'm truly grateful to have had support from the team, as well as support from my family, even though they were not around, but they were quite supportive from afar, as well as support from my friends. And I'm very grateful that when things got a little bit better and I was feeling very overwhelmed, I'm grateful that my team did allow me to take some time off. I was able to take 5 days towards the end of July, to take 5 days off. And that really helped me to gain my physical and emotional strength. And I felt really better when I came back to work. So that really helped me a lot. So I'm really grateful for the team. I worked with such a good team. It's such a strong team, and they were supportive. I'll forever be grateful for that. These are my last slides. These are some of the beautiful pictures that I took hiking. They just made me realize how beautiful God's creation is. And I can truly say that we all survived this by God's grace. And thank you so much for listening.
Thank you, Nonti. That was a wonderful presentation. Really appreciate it. And appreciate how candid you were as well. It gives me great pleasure to introduce our next speaker, Dr. Arifa Parker. She's an infectious diseases specialist working at Tygerberg Hospital. She received a Discovery Award to train as an infectious diseases specialist. And she's been very actively involved in the hospital's response to COVID-19 right from the beginning. So Arifa, we look forward to your presentation and thank you for being part of it.
Unmute, Arifa.
Thank you. Good afternoon, everyone. And I just want to thank the Women's Forum for including me in the Women's Day program. Can I ask if you're able to see my slides?
Not yet.
No?
No, it's coming. There we are. Yes.
Awesome. Okay. So it's been really hard for me to condense the past very intense 7 months into a 10-minute talk, but I'll try to do my best. When we received the invite and we saw that we were described as warrior women who were fighting the pandemic, it did make us all a bit uncomfortable with the label, because even though it does feel like we were in battle and we are all battle weary and have COVID fatigue at this point, we do really feel that we were just being ourselves, we were being women, doing our role to improve patient care and the health system, and we just did what we thought needed to be done. So in contrast with the sort of negative terminology of being warriors and fighting, we felt that we approached this pandemic with kindness, compassion, and we tried to be friendly. And I want to thank my colleague Saad Lari for this quote. So my talk is going to discuss my role and largely lessons learned during the pandemic. As you've mentioned, I'm one of 3 infectious diseases specialists at Tygerberg, along with my very awesome colleagues, Janki Taljat and Hans Brzezinski. And I'm sure we've all learned these very valuable lessons. And what I do know is that the COVID pandemic has really been a major lesson in humility for us, not just on a local level, but on a global platform. Um, Despite us, in 2019 believing that we were this progressive society and could achieve and do everything, this tiny little virus has changed the world forever. Lots of people have lost loved ones, lost their livelihoods. We've been forced into extreme social distancing. We were unable to participate in gatherings, sport matches, and concerts were cancelled. Religious pilgrimages had to change. So we've all, from a medical point of view, we've also learned, even though we thought that we almost knew it all, that there were no COVID experts. And, as ID specialists, other specialists globally, we have had it wrong at many points, and we've had to sort of learn and unlearn and relearn as new evidence became available. So definitely, it has been a very humbling experience. So at Tygerberg Hospital, I first became involved with the COVID-19 planning as far back as January, going through my WhatsApps and things in preparation for the talk. I see we actually saw our first patients, suspected COVID patients in January. So in the beginning, the pandemic, well, we didn't know it was going to be a pandemic then. The COVID response was largely driven by our infectious diseases department, which was myself, my two ID colleagues, our senior reg Riza, and our medical registrar Sumant. And we were the referral center for all suspected COVID travelers via Port Health. And this was a disease that we had never seen before. Obviously, we only just heard about it, so our learning curve was really, really steep. But one of the approaches that we've had from the start is that teamwork on multiple levels was absolutely essential. So for the first few or many few patients as consultants, we came in for every single patient. We familiarized ourselves with PPE protocols, what worked, what didn't work, so that we could try to make things easier for the rest of us. And I'm so grateful that we put in those extra hours. It was exhausting. We were here every weekend. Friday nights, for some reason, a lot of the flights ended up landing on a Friday afternoon. So we spent a lot of Friday nights in the hospital seeing travelers. And the pictures on the right are actually pictures of a dry run that we did in conjunction with disaster management, local CDC. And as you can see, there are lots and lots of key role players that were involved in this very, very important COVID response. Towards the end of Feb, early March, it became too much. And I think that is also very important, acknowledge limitations. We approached Nishad Schroeder, who was the head of GenMed, and management obviously was very, very supportive from the start. And I'm so grateful actually for our management team at Tygerberg, who actually listened to our concerns, from the get-go. We were very worried. We weren't sure what to expect at the time. So Usha will tell you some hilarious snippets a bit later. But we really didn't know what we were getting ourselves into. But the motto of our preparation than under-prepare. And that is what we did from the start. So the approach was, from an ID department to involving GenMed, it eventually became a whole hospital response, with all departments playing their role. And I'm so grateful to be surrounded by colleagues who are able to think out of the box, and really assisted us in making this very complex response simplified, and it was definitely teamwork on all levels. So as this virus was new, we had to adapt as we learned. We had to lose a lot of control and try to be flexible, and we tried to be fast adapters. So the picture on the far left is like multiple bits of paperwork that we had to complete for the initial few patients. So every patient we wanted to test, we had to discuss with a gazillion people. So we had to discuss with a consultant at the NICD, and they would listen and they would check the exact geographic location of the patient to see if they were really at risk for COVID. And we've come a long way since then. We had to fill in multiple amounts of paperwork for CDC, NICD, and every other D in the beginning, and it was really, really exhausting. The middle picture is actually our initial COVID protocol, which we actually fit onto one page, and I actually laugh looking at it now, because we don't have much more in the way of management of this disease, but we've definitely learned a lot since then. And we've definitely learned to simplify and streamline. So at Tygerberg, we've really tried to stay ahead of the curve, and we've tried to learn from other countries and anticipate what was going to happen next. So what our role here was to improve that dotted line, to lift the dotted line so that we could improve our healthcare capacity. And our focus was basically on staff, equipping staff, keeping staff healthy, making sure that we had adequate PPE, that people knew how to use PPE and get equipment. So a lot of our focus was on those three groups. And I do think, I'll show you some pics, that we did stay ahead of the curve. We did not have those scenes that we saw in the media, full ECs, emergency rooms with COVID patients lying everywhere. So to try to keep staff and other patients safe, we decided to bypass the emergency units and put patients directly into single rooms. But and so to eliminate other infections. It was quite exhausting for the registrars who've been amazing, because they literally had to run from floor to floor. But overall, it was quite rewarding. So new virus, new protocols, new paperwork. We wanted patients not to enter the hospital. We wanted to pick up patients before they infected others. So we chose entrance 5, which was closest to the main gate. As you can see, that little makeshift screening area was set up by our awesome support staff within a matter of a day or two. And we had cubicles, and we had rooms with negative pressure ventilation for swabbing. And this was just before lockdown. Our initial plans were drafted in our little war room in the IPC seminar room, and that plan on the whiteboard is actually the flow through a testing center. And what we've done at Tygerberg was actually quite remarkable, because that exact same flow and design has been adapted at every single testing center in the province. So we definitely have an amazing team at our department. And on the right was, Usha will tell you a bit more, myself and Usha met very early on to prepare for on an off Saturday at a coffee shop, and we sort of planned the ICB response. It all started off quite small, and in the end, we were prepared for chaotic scenes like this. And overall, we've had very good feedback from patients who we managed to triage hundreds of patients within a day, because we had planned, and we had systems and from all at all levels within the hospital. Just some pictures, consultants working at night. Helena Rabi has been an instrumental female role model for me, and I've learned so much from her and the rest of the team. Yeah, crazy. So we didn't just assist other hospitals. So I was very privileged to do visits to many hospitals within the province, and I actually learned so much from visiting them. Mitchell's Plain Hospital, the pink wheelchair is from New Somerset Hospital, and that is how they were able to identify their COVID equipment and ensure that it was clean, so that there wasn't any cross-contamination for other patients. Paarl Hospital had surface disinfectant at every surface, which was quite impressive. And then Kolbrema also had amazing systems in place with very minimal staff. So I was quite privileged to see all of that. And then this is the initial plan for hospital admissions, which eventually became a provincial document. So for hospital admissions, we wanted to protect staff. So adequate PPE, etc., donning and doffing. We did lots and lots of videos, disseminated guidelines, etc., and then we ensured that flow was optimized. So an undifferentiated respiratory patient would be called a person under investigation, would be kept separately from other patients, and if you were COVID positive, you would be then cohorted with other COVID patients to save space, and that's sort of the protocol that's been used everywhere. Lots of amazing people in the wards that made all of this possible. The field hospitals definitely made a huge difference. So the top right is Brackengate, and you can see the enormity of the COVID problem with all those visors and visor cleaner at Brackengate. And then the top right is CTICC, which is now closed. And bottom right is Tusong, which is in Kainicha. Also played a huge role in our COVID response, and Tusong's also been closed, fortunately. So we've had lots of lows. I think the biggest low for me came at the time of this New York Times article. And if you look at all these names, it looks like a list of deaths in a battlefield. And at the peak, that is exactly what we went through. I think the hardest for me was seeing a 34-year-old patient at the peak who'd had no comorbidities except for being a bit obese, being so acutely ill with this virus. And we've had lots and lots of amazing staff members at Tygerberg and elsewhere in the country and world demise from this virus. And also we've all know of family members or acquaintances or friends who have been who have been affected by COVID-19. So that's definitely been a low. And I think the enormity of the problem struck me when I first went to CTICC and actually saw these huge AFROX oxygens. So the one on the right is CTICC, the other one is at Brackengate, oxygen canisters. And this is how big this COVID problem actually was. Throughout all of this, we've learned things, and we've also had to unlearn things we thought we knew and relearn new things. So that was a big lesson. I must thank my colleagues Abu and Bram for keeping academics going within our COVID teams. So there are twice weekly talks, journal clubs done by registrars and/or consultants working within the COVID departments. We thought steroids were bad. The initial guidelines said do not use steroids based on previous experience with MERS, influenza, etc. But then the recovery trial showed us that dexamethasone definitely made a difference. So the absence of evidence definitely equal the evidence of absence. So in this crazy time of the pandemic, I'm happy to say, I show these folders because a lot of my time and our time in the department has been spent not just on clinical duties, but we've also been doing a lot of research. And I'm very proud to say that a lot of our registrars and interns have written or partaken or have done research within the department. And I'm pretty happy to say that between Usha and myself, we have at least 5 first author articles. I don't know where we got the time, but we tried. I'm very grateful to all of the people who sponsored goods. We've had long days where we actually forgot to eat. We've all lost weight. I've lost 15 kilograms of weight thankfully, during this COVID time. But we've had lots and lots of sponsors who have dropped off coffees, teas, cupcakes, and it really made a huge difference. So the small things and then also the big things, and the middle picture shows high flow oxygen machines that were donated by Gift of the Givers who have been really helpful. Other organizations as well donated PPE, etc. And then the picture on the left is are my 2 little girls eating donated goods from Fair Cape. I think we left very late, and I took 2 for them, and they were so happy. This was at the height of level 5 lockdown, so the shops were closed, and so little bits of joy to be found in the pandemic. I do have to, since it is for Women's Day, highlight that there are historic inequalities in the system. And COVID-19 definitely highlighted a lot of this absurdities. So this was a BMJ opinion asking where are the women experts in COVID-19, mostly missing. So as women, we have multiple roles, but to play. And I do think that we should use our voices. I come from a background where women have an elevated status. And there are many women role models who are amazing. So I come from a background of Islam, and one of the first person to become a Muslim was a woman who was multifaceted, She was a very successful businesswoman, a mother, and a wife, and she did it all. I'm surrounded by women who are amazing. My grandmother and my mom are both working women. My grandmother had 9 kids and she worked. My mom had 5 children and she worked. So we can definitely do it all. And just to end off on the inequalities, where I come from, a man's character is also defined by the way he treats women. And you know, in this time of Me Too, etc., I think that's really, really, really important to remember. So as women, we need to use our voices and not tolerate any sort of discrimination. So the Daily Maverick article, I had a bit of flack about it. So I got asked about cooking, and you know, what meals do I cook, etc. And I was very taken aback, and I was a bit upset because no one asks other ID specialists like Yankee Talia what in an interview, what food do you make, or Mark Mendelson or other male ID specialists. But then I'm actually okay with it because as women, we have multifaceted roles. So we are not the same as men. We are different, and we should appreciate whatever roles we have. So I enjoy cooking, so I answered the question. But I think what does need to change is if you're going to ask the woman ID specialist about cooking, perhaps you should ask the males as well. I'd be quite interested in knowing what Yankee or Hans cooks on occasion. So, family life. I get that question a lot. How do you cope with the kids and work? They are such joys. I think I've touched on it before. I think you can. I think looking at so many women that have excelled in academics and family, that you shouldn't feel guilty about what you do. I think you should do what you do well, so that your children look up to you as a role model. And just this is, I think, my last few slides. COVID for me has been really, really tough. I think for all of us, I think lockdown's been tough. We've been physically and socially distanced from family and friends. But I firmly believe that in any times of darkness, there will be ease. And you need to look at the beauty in life. So I took renewed pleasure in simple things like going to the ocean and looking at the sea, going for walks, etc. And that sort of kept me, I tried to keep me sane in this crazy. And just to end off, we have to be able to adapt to change. This was a bridge somewhere, I can't even remember which country it was, Honolulu, that was built to last. And then there was a hurricane, and everything around the bridge was destroyed, all the roads, etc. And also the river that flew underneath the bridge actually changed direction and flowed alongside the bridge. So what we need to learn in this time of COVID is that the best solution to a given problem is is that the problem actually might change. So you should rather build something to adapt to the problem. So we're all going to have to adapt to our new normal with COVID. And I don't think things will be entirely the same as we've known it before. So we're going to definitely have to adapt to change in the future. Thank you.
Thank you very much, Arifa, for that very special presentation. It now gives me great pleasure to introduce Dr. Usha Lala. She's a specialist physician and intensivist. She has lots of postgraduate experience both in the UK and in South Africa. She's dedicated herself to rendering an excellent and efficient critical care service that is of the highest possible standards within the prevailing financial and human resources constraints. She's currently heading the designated COVID ICU at Tygerberg Hospital and has done the most amazing job. So Usha, thank you very much for being prepared to share your experience with us.
Okay. Guys, can you see my slides?
Yes, we can.
Oh, excellent. Thanks, Sharon, and thanks, Commentary, and thanks to the Women's Forum for inviting me to speak on this panel. It's truly an honor. So as Sharon said, my primary role here in Tygerberg was heading the COVID ICU during this pandemic. But, women have tons of different roles. My other very super important role was obviously being a wife and a mom to very active, strong-willed children during this time. One is 2 years old and one is 6 years old. And for those that have children at that age, this was no easy task, especially in a pandemic. I'm going to start with the easier bit, which is the COVID ICU, as compared to the family. So this is A5 medical ICU. This was predominantly the medical ICU before COVID, and during the pandemic, obviously became the designated COVID ICU. Our motto in the unit, even before this year, was always faith, hope, and love. And I can tell you, it has never been as fitting as it has been over the past 6 months or 7 months now. We started off with about 7 beds. All of them were intubated and mechanically ventilated. Our total staff in general was only about 50 to 60. But by the time we were well into the pandemic, we had expanded it to almost 32 beds with COVID patients. And the last time I counted, there were almost 190 different people, which was dedicated to working in the ICU. Since our first patient in March, I think it was March 27th, my boy's birthday actually, we have admitted almost 340 patients to A5 ICU. So a busy time. And obviously in such a busy ICU with so many different people and a high turnover and just, both staff and patients, there were so many challenges, and I'm really not going to go into the details. But, those couple of months, and it's settled down a little bit now, but over the past 5 or 6 months, it's just a blur of chaos sometimes, with people coming, or control chaos, people coming in, discharges, deaths, high turnover of staff, and every day there was always a challenge. Despite planning and meticulously planning for everything, we were still inundated with daily challenges, and a lot of the time I spent just trying to put out fires as they come up every day. And obviously the disease itself was crazy. It read no textbook at all. For an intensivist and for a doctor who's used to managing critically ill medical patients, they did not follow any rule. So from a medical point of view and a doctor point of view, we are also, quite in the deep, and which also kind of shifted our base or foundation quite a little bit, because a lot of the times we just played it by ear and kind of learned as we went on. as I said, there were tons of challenges. But from my personal point of view, I think the one thing that made the most impact on me was the limited resources, for which was, generally unavoidable. And I remember this was one of the days when I looked, and this was one of many during in the peak of the pandemic, when I looked at the board and I felt such helplessness and frustration and just despondency. The picture on your left, the picture on your left is the patients admitted to the ICU on that particular day, while the picture on your right were all those patients waiting to come in. And because of all the limited or the as I said, the resources or the staffing that was quite limited at that particular day, we could not help those 12 or 14 patients on the board. And I tell you, it was soul destroying for me and soul destroying for the team, including, right trust, the nurses and the doctors. And it was definitely one of the lower periods of this pandemic for the ICU. But there were many times that there were a lot of highs, and I'm not going to mention a lot, but the two that stands out for me, that were the highlight of this pandemic, was this patient. So he was a patient called Mr. M, and he was our first patient that was discharged after being intubated and ventilated for quite some time. And prior to pre-COVID, it would have been a normal day. But, the mortality of patients that were intubated and ventilated was extremely high and still remains extremely high throughout the world. And that was our experience till that time. And we had lost many patients to COVID pneumonia at that stage. And this man, his discharge was not just the fact that we managed to get him out of ICU, but he represented hope. He represented that there was a light at the end of the tunnel. He represented that, he was a symbol of all the work that we were putting in at that time, all the angst and all the crying that we did, that there was some sort of benefit, that, that we would get something. We would achieve what we wanted to do, and that is to get people out of the ICU and back to society. The second highlight that I think made the most difference to me and the rest of the team as well was high flow nasal oxygen. I'm sure some of y'all are aware of it, and this was for me the turning point of the ICU, not just from a operational logistic point of view in terms of, it reduced quite a lot of the burden of the ICU resources. On the patients itself, it was an amazing change. These patients would have been intubated, ventilated, and sedated while they were awake. They were communicating, and we managed to actually have a relationship with them, which we never did with the other patients. And for the team, once again, it gave us a sense of relief that, we weren't going to be as inundated and overwhelmed as all those videos that we were seeing coming out of Italy and Spain of people being denied ICU care because of the lack of beds and ventilators and monitors. High flow gave us a way out. It gave us a hope that we will be saving many more people than what was originally anticipated and what we were so scared of from the time that we started this whole pandemic. Looking over the past 6 months, I think the one thing that stands out for me, and Arifa has mentioned it before, is teamwork. For me, it was just not more than teamwork. It was the almost palpable spirit of the Tygerberg team, the camaraderie, the feeling of being in this together, of helping and supporting and communicating, of trying to make it work even when things were so difficult and so dark. And for that, I think, is indescribable and was absolutely priceless, and something that I would take into the future for certain. more on a personal note, and I actually thought one of the questions was, how did I experience, or what did I experience in this whole pandemic? For me, very seriously, it was pride. Pride of not just being part of an amazing team in the ICU, in the Tygerberg Hospital and across the platform, but pride of being a woman in this pandemic. You know, A5 ICU is run by women. The vast majority of our staff are women. I think there's about 80 or 90% women, strong women from all different backgrounds that got together during this pandemic. Women that had challenges just like any of us, you know, at home, at work. Women that did their utmost best to do the best for their patients all the time, despite their emotional and physical exhaustion. You know, women who cried together, who laughed together, who supported each other, and yesterday who actually danced together, you know. And this was in a period, as one of them told me last week, and has been echoed many times during this month, probably the darkest and the worst time of their lives. But being part of this team, especially in the A5, in the ICU, was for me indescribable. And this pride of being a woman extended was not just in the ICU, but it extended outside the ICU. And I had the privilege of meeting, of working with, of getting to know fabulous, phenomenal women that are in high positions, who are not scared to do what they do best. And for that, once I'm internally grateful. But coming back to home, or coming to home, you know, it hasn't been easy. As I said, I'm the mum to two very, very active, opinionated, stubborn, strong-willed children. And I would love to say that I achieved that work-life balance that everybody talks about. Oh, I didn't. You know, the ICU consumed me. And especially during the lockdown, where other mums were doing things like building Robinson Crusoe houses in their backyard and making Play-Doh and doing all these crafts, my kids, unfortunately, you know, spent a lot of time on the iPad and on TV. And the reason is why both my husband is an essential worker as well. And, you know, we were just never at home. This was a massive issue for me because, you know, prior to COVID, I was very strict about screen time. But I realized, you know, at one stage, my little girl, about a couple of weeks ago, I realized she's speaking with an English accent. And she said, Mommy, she started calling me Mommy, Mommy. And I realized, where on earth did she get this English accent? And then I realized she's been watching this Peppa Pig. When this pandemic started, she could not speak. She's only 2, she just started speaking, but she had watched so much TV, especially Peppa Pig, that she now literally calls me Mommy. The other worry and the guilt was my son. You know, he's a 6-year-old and he's old enough to understand about coronavirus and follow the media and see how people were dying. And he was absolutely anxious and stressed about me working in the ICU. And I remember in about April or May, he used to come to me randomly to feel my forehead to see if I had a fever. And when I asked him, why on earth is he doing that? He said, you know, he knows that fever is the first sign of coronavirus. And he's so scared that I would get the coronavirus and die and leave him alone. So all of these things, you know, as mum, really made part of the pandemic not easy at all. But I also realized, and I reminded myself, or it was a reminder that, I chose well when I married this man. And he has been my rock and my sanity and got me through this. He's an essential worker himself, and he'd probably hate knowing that I've actually put this photo of him on it. But he was there and managed all my trauma, all my moods, my anger, my venting, my crying, my everything that I've been through the past few months without a complaint. And he watched and looked after the two kids without any hassle at all, despite having also quite stressful job. And the other two amazing women that helped me manage this time was my domestic and nanny Alu, and an au pair called Jody, who we enlisted the help with one's online schooling, because very soon we realized there was no way that my husband and I could keep up with all the homework that was sent. Even my daughter was sent worksheets that had to be sent in. So we've got these two women who are, once again, two strong, powerful women who did their utmost best to make life extremely easier for me. And even at many times just treated me with, as you can see at the bottom, this was one of the days when we came home, and Jody had made me Dom Pedro's, which, one of my favorites. How did I manage with it? Well, I reminded myself that, children are resilient, and that I am doing my best, and that, one of the days I heard my son talking to one of his friends, and the pride in his voice when he spoke about his mum helping patients with coronavirus made me cry. And I thought, maybe not all is lost during this time. And obviously, there's this man who helped me through work. For many of you will know him as Professor Kunrad Kuchlenberg, Professor of Pulmonology at Stellenbosch University. But for me, he's Kuni, my partner in crime, my work husband. And for him, I'll be eternally grateful. When the pandemic started, he doffed his pulmonology hat and ran headfirst alongside me throughout all these months. And he has been my rock at work. And obviously, I worked with an amazing team that despite against all the challenges, the emotional ups and downs, the physical exhaustion, still did their best to make sure that the patients in A5 ICU could get out and get back to their families and get back to their homes. So what lessons have I learned? And I've just mentioned a few. There were quite a few. I learned that you have to believe in yourself, and you have to believe in your convictions. You have to stay true to yourself, and you have to know what your purpose is in life and what you want it to be. I realized you can't be scared to take informed or calculated risks despite criticism. You have to empower yourself, and even more importantly, empower others. And lastly, I think extremely and most importantly, you should never apologize for being a strong or a powerful woman. Thank you.
Thank you very much. That was an absolutely awesome presentation. I'd like to know. Sorry, I'm getting a bit of an echo here. I'd like to introduce Dr. Nadia Ahmed. She's a surgeon intensivist and is currently the interim head of the Consolidated Critical Care Unit at Tygerberg Hospital. She serves on the Council of the Western Cape branch of the Critical Care Society of South Africa, and she's contributed to the National Critical Care Guidelines. She aims to progress critical care education to leverage the workforce and allow critical care services to reach more people. Nadia, we look forward to your presentation, and thank you for being prepared to be part of this Women's Forum meeting.
Thank you again to the Women's Forum, and to you, Prof. Kling, and to Prof. Mudley. I just want to quickly check, can you see my slides?
Yes, if you could just convert it to a slideshow, please.
Okay, I think then you're seeing the wrong one. Hang on, let me try again. There we go. Is that the slideshow now?
Yes, perfect. Thank you.
Okay, thank you so much. Firstly, I also want to just say thank you to the rest of the women on this panel, because definitely without any of them, none of what we've been able to do would have been able to be done. You'll see that I actually put here that this is a juggle, and I put pandemic in brackets. And the reason for that is the juggling is not new for any of us. We've all been juggling for a while as women in medicine, whether it's just juggling between when we register studying and home, and then into also getting married and having children and continuing to work and progress our careers. So the pandemic just added one more ball in all the balls that we were juggling all along. And some of the balls that we juggled, as I said, and some that I personally juggled was, besides being the interim head of adult critical care, like was mentioned, was also being a wife and a mother, being a daughter and a daughter-in-law. And as a daughter-in-law in a conservative Indian background, it included going through our holy month of Ramadan and 2 Eids with all the preparation that comes with that as part of our tradition. But also in this pandemic, had to become a teacher in order to help my children with homeschooling. And this was over and above my duties and responsibilities at the hospital, which was, as the interim head, it is to oversee all the administrative and management issues regarding adult critical care, as well as the clinical management of patients and teaching and maintaining the teaching program. So the pandemic itself, what was it for me? It was about maintaining the status quo, and the status quo being that we had to, whilst COVID had come about, cancer didn't stop. Trauma, thanks to the lockdown, did slow down, but didn't stop completely. Appendixes didn't stop coming. Pneumonias, not due to COVID, didn't stop happening either. So whilst we were building up resources for the COVID pandemic, we had to also keep in our mind that we had to maintain the 21 adult critical care beds we had prior to COVID for all the other non-COVID pathology. And this, as Usha had mentioned in her discussion, was in a background of limited and financial constraints. So we had to learn how to borrow and how to move things around and how to find other solutions. And one such solution was when we were waiting on equipment, and like the rest of the world, we had to wait a long time because we were all competing from the same pool for monitors and ventilators and the like, was a discussion that I had with the then acting executive HOD of the Department of Anesthesiology and Critical Care, Latifa Furfrey, to somehow borrow the equipment out of the post-anesthetic high care unit. And she and I sat and we tried to work it out. How could we give the equipment over to A5 ICU whilst maintaining the post-anesthetic high care unit, because we needed the backup for extra critical care beds. And it's only when you sit down with another person and look at all the things in front of you that you can come up with an idea. And in the end, we were able to get the equipment upstairs. And she then got her technologist involved, and they decided to use 2 decommissioned anesthetic machines that weren't being used at that time as their high care equipment in the post-anesthetic high care unit. So it required that. It required walking around the hospital. I think I found new places in the hospital that I never knew existed before. I found out where the general stores was, and it's an impressive place. So I literally explored different avenues in the hospital just to, for myself, get firsthand information of what is happening where, and understanding the system in its completeness, to know where in the system there's a hole and how can I help get that hole filled, or how I can get the bridge laid over so that we can move along a little bit quicker. But more than that, I also was involved as a general surgeon by speciality, have links and associations with the surgical disciplines, spend some time trying to convince them that COVID is not just a medical problem. It's a problem that is going to affect everybody. And, it was very difficult in the early days trying to convince them of the need and why we would need their staffing. And, it doesn't matter that you're just an orthopod. We we need you, and you're a pair of hands, and we need as many as we can get. And this was in the backdrop of having to maintain teaching and training, because a lot of these registrars still come to us with the expectation that at the end of their 4 or 5 years, they would leave with their specialty degree. And this obviously then put a spanner in their long-term or short-term planning of how they would get there. And we had to try to make a plan to still continue teaching and training, especially for the surgical disciplines who write intermediate examinations involving critical care. It required me to get out of my technophobic box a little bit more and find new and inventive ways of delivering teaching through virtual media and recordings. And somehow we got together and we made a plan and we made it work. The next 2 slides are really not meant for anyone to be able to read. I just want to show you what I eventually did, because I used to do these initially 6 a.m. walkarounds in the hospital, because I'm a morning person, not a night person. And just trying to figure out where are the beds and how many people need to be manning these beds, so that when there was any kind of question regarding that, I had it at my fingertips. And this slide was just one that I did looking at the different areas and how many we needed in terms of nursing and registrars and consultants on a specific ratio. And I think this is a one that I used to print and walk around with, just to do ticks and checks to make sure that if a monitor was delivered, it was physically put in the right place, so that I could physically say for sure that bed was ready for use. And these tables kind of governed my life and helped me keep control for a little while, because at the top of my head, I couldn't remember all these numbers. And I had to have a go-to place that if at any time I was given a phone call, I would know exactly where to go and get that information from. So there was a lot of paperwork, a lot of administrative work over and above everything else that I did. Not forgetting that Usha and I are 2 full-time intensivists, and the only 2 full-time intensivists that Tygerberg Hospital has. She was totally and completely understandably busy in the COVID ICU in A5, which meant that I had to be then the sole intensivist for the low-risk COVID population downstairs. And what this meant was that I had to also be clinically available 24/7, as well as being available from an administrative and managerial point of view 24/7, just to troubleshoot any kind of difficulties with the response, or if suddenly there was a hiccup in the plan, what was the alternate plan. It felt like playing musical beds for a very long time. And still till this week, we still are playing musical beds. If someone crashes in one area of the hospital, trying to figure out where can we put them in the hospital system. But I think this was said several times over, and it was a 9-year-old by the name of Tanika Chetty who actually reminded me of this, that teamwork makes the dream work. And there were many people in this team that helped us to keep the ship afloat, people that one could really count on. They helped to manage anxieties amongst each other, and just sort of like, because of having this massive team support, if one was having a bad day, the next one would pick them up, and it would go around in a circle like this. And I don't know, this almost feels like an Oscar ceremony, but I really want to acknowledge some of the people in this team at this point in time, because I think they go largely unrecognized. At work, there were people such as Dr. Roshni Mistry, who I don't know how we would have done this pandemic without her. Personally, on my front, my colleague, Dr. Danielle Sheed, who is one of my consultants, who's been a rock, and whenever she saw me running around was always, what can I do for you, Nadia? How can I help you today? What else do you need? What can we do differently for you? As I mentioned, Latifa Furfrey was a very active member right at the beginning of this COVID pandemic, and she was a massive source of support, as well as Teresa Lowe from the Department of Anesthesiology and Critical Care. Elise Lowe up in pulmonology was always running around. She's sort of crackerjack, trying to always see what she can do differently, how can she help. From the nursing staff, I mean, my nursing unit manager, Sister Hanekom and Sister Ngayo were amazing, and upstairs, Sister Scully, as we call her, but Sister van Skalkwijk and Sister Bev were also really amazing, no matter how short they were on staff. You know, we always sat around and said, can we make a plan? How can we do this differently? How can we make a plan? Lots of friends and family as well that kept things going. I live alone in the Western Cape with my family, but my immediate family, my mum and my siblings, are all outside of the province, and I haven't seen them for more than a year. But my mom keeps in touch with me frequently, and she's a strong woman, and it's from her that I learned that nothing is impossible. So she's definitely in the picture. And that's just me talking about the woman. There are many men as well behind the scenes that make a strong woman. And one of those men is definitely my husband, who did a lot to support me in this time. He was the person who was the sole provider largely for our children whilst I was running around. He's put up with all my moods. He's put up with all the tensions that I've brought home. And he has made me laugh, and he's made me smile and tried to get me out of my shell at times when I was very tired as well. Besides the men at work who make a huge difference, that being Ryan Davids and Mani Domingo, who are in my immediate team, as well as Professor Chetty, who when he returned has been a source of support for us as well. So some of the trials and tribulations that one went through, and one of the biggest things was, and I think Usha alluded to it as well, was how do you multiply from 0 and not end up with 0? And it took a lot of leveraging. It was a little bit of this and filling in. I felt like polyfiller, putting out little fires and trying to turn that 0 into an 8 by stacking one on top of the next. In this process, I had to understand a lot about management systems, how they work, to know where I can be flexible and where I can't be flexible. And through all of this, what I learned was that communication was very, very vital throughout this process. But for me, the bigger lesson in communication was I had to learn how to do more listening and less talking, because I had to really listen to what people were saying and take it away and digest it before I had any kind of reply for them. I also learned that staying with what is true is best, because if you stick with the truth, you don't have to shout and you don't have to be the loudest voice in the room. And the bigger lesson I learned was that more is not necessarily better. Sometimes it is just more. And this lesson particularly came in with my children and my family, when I realized that actually all they really wanted was a little bit of quality time. So they'd rather have mom there for 5 minutes of the day and have her full attention than 3 hours and I'm between my cell phone and my laptop and making another phone call and being disturbed every minute of the time that I was with them. We celebrated a few special moments in this pandemic, one of which was I turned 40. And I was at work on that day, and my team made it a memorable day with this Game of Thrones cake and having a little party for me at work, which was, not the way I had planned to spend 40, but they definitely made it much better than what I thought I would be doing on my 40th birthday. I celebrated my 12th wedding anniversary with my husband, and again, at a time when I didn't really want to be going out and I didn't want to do anything. He knew that what I needed was actually just a little bit of time to dress up and be out of scrubs. So I put on a dress and a pair of heels, and we went out for dinner, and I felt tons better thereafter. My oldest son turned 11, and one of the things he loves to do recently is explore different coffee tastes. So I managed to sneak out of work a bit earlier. I don't know if I should be saying that on this forum, but I did. And took him out for a quick coffee, and it was just half an hour of him and I alone, one-on-one time, mom and son date that made a world of difference. And just out of interest, and it goes back to what I said at the beginning, the pandemic added one more ball to juggle. It's not that we haven't been juggling all this time. And the picture right at the bottom is with me and my youngest son, and this was actually in 2019, when I was the co-scientific chair of the National Critical Care Congress that was being held here in Cape Town. And I never usually attend the Saturday morning rugby sessions of my son because I'm either on call or too tired or busy doing something else, work related. But he knew that no matter what, mom would always come to the inter-school rugby tournament, which was the highlight of the rugby season. And it so happened that in 2019, that fell on the Saturday that was in the middle of that Congress that I was the co-scientific chair of. And I went from a breakfast symposium in the morning in my conference dress, heels and makeup to the rugby field, and then from the rugby field back to the conference to speak in the afternoon. And so that's why we juggle all the time. It's not new to 2020. It's not new to COVID. It's just about keeping the circle going, and it's nothing that we're not used to doing at any given time. Again, I thank everybody for allowing me to speak and for their contributions at this forum. Thank you.
Thank you very much, Nadia, for a superb presentation as well. And last but not least, we have Sarita Kannenberg. She's a bit of an odd person out because she's a dermatologist and not a critical care specialist, but she played a vital role during this pandemic, and she would like to tell us about it. She's an executive member of the Dermatology Society of South Africa and the African Women's Dermatologic Society. She's got lots of other attributes that I don't really have time to share with you now. But Sarita, we look forward to your presentation. Thank you very much.
Thanks so much, Sharon and Kimantri, and thank you very much, everyone, for this opportunity. You can see my slides, right? And you can obviously hear me. I'm just checking.
Yes, it's perfect. Thank you.
Perfect, thanks. Okay, so yes, thank you for this opportunity. I am a dermatologist and not an intensivist. I've never ever ventilated a patient. So a little bit of non-invasive ventilation, but I got the opportunity to do what I do well, and that is to support other people. And I would like to share my experience of this. Hopefully, it's a little bit lighter than the others, but I will just. So from February 2020 to 2020, so this was before the beginning. I didn't really know a lot. I don't really follow the news that much, so I heard about this virus, didn't know a lot about it, and then stress levels in my home shot up. Because the husband, who I'll show a picture of later, but most of you will probably know who he is, but the husband started to scare our friends with predictions, and he was just telling everyone how bad it was going to be, and my friends just didn't want to have barbecues with us anymore, and I got a little bit angry at him because of that. But and I thought he was really overreacting. But then it really actually felt, as I was looking at what was happening, is that it felt like I was going through these stages of grief, because initially I was denying this whole thing. And then the anger and anxiety really struck. So the realization of the magnitude of what was coming struck me middle March, when this very good friend of mine, an intensivist in Spain, I could see that she was waning away in front, in front of my eyes. And I could see, and she sent me a message, and she said to me that it really is as bad as everyone says it is. And she was telling me how she was holding people's hands while they were dying because their family members couldn't get to them. And that was really, really scary. So then massive anxiety struck. And then I was attending all possible meetings to learn about what was coming. And that's when Arifa actually told, it was one of her meetings that I attended that really kind of showed me what was coming. Then this depression almost struck, because we had these family gatherings where Kuni actually told me afterwards that that he has made peace with the fact that this is probably the last time that he will see his parents. So and obviously, I obviously had to keep that in mind as well with my elderly parents. So and then acceptance followed and jumped into action. So if we look at the action, my initial worry was mostly the psychological aspect. So I was really worried about the mental health of the staff. I didn't really see that there was a lot of attention being paid to that in the very beginning. I could see fear in everyone's faces. And I could see the fears of the collateral damage as well. So the non-COVID patients as well, or the potentially non-COVID patients as well. And then I learned a whole lot of terms like moral injury, and I learned things like obviously social distancing, so all of these awful terms. And then with the help of many wonderful people, all of these type of initiatives came off the ground. So this mental health support, just so it's care for the carers really. So that information was sent through the hospital as well, and posted in the ICUs. And then these more and more of these posts I saw on the Facebook and those type of places, and really that really reassured me a little bit that we are actually looking at this problem. But then I realized that I had to put on my own oxygen mask before I could help other people. And in particular, I was really referring there to my family. So because I'm married to an Afrikaans man who was told from baby time that you don't show your weaknesses and that boys don't cry. So I realized that I had to find some way to be able to help him, and also to be able to help my children who were crying constantly. So this fantastic initiative was then brought out by I had nothing to do with that, but I grabbed onto a hold of this opportunity, and I attended this resiliency clinic and learned a lot from that, which I could use when I spoke with my colleagues and obviously with my husband, and also these type of initiatives also became known to me. So Timandri actually joined us on this WhatsApp group with some very well-known people in the field of mindfulness. So mindfulness is where we pay attention on purpose in the present moment and in a non-judgmental way. And so we had these type of WhatsApp meetings or WhatsApp messages every day that we could help, that we could use. And then and there was a whole lot of evidence. We know that some people think that mindfulness is mumbo jumbo, but we know that there is a whole lot of evidence, and we wanted to prevent this burnout emotion, and we wanted to make sure that people stayed well and that people didn't struggle with PTSD and had to be booked off for years after this whole pandemic. So we also they also taught me about how we could use mindfulness even when we're washing our hands and when we're walking upstairs. But then, of course, more than psychological, let's look at what happened, what I could do to support my family and myself in a biological manner. So suddenly I discovered all this culinary skills that I never knew I had, because Arifa, I don't know if you're still there, but in my house, usually the husband did the cooking. But I like to do the fancy cooking. So I had to make sure that everyone kept healthy. And then the other thing that actually became so obvious is that we are so interdependent on each other, because if I got sick, that meant that my husband was is going to be out of rotation at work. Maybe he even got sick. And then if he got sick, the ICU consultants in the COVID ICU would also get sick, or they'd have to be isolated. So everyone was reliant on each other. So we really had to try and make sure that we kept as healthy as possible. There were some other bio ways that I helped as well a little bit. Obviously, as women, we like our hair to look nice, and we want to feel better about ourselves. So that's the one side of it. But the other side of it was that these ladies had to wash their hair twice a day, and to get a load of hair to dry in the winter time is difficult. So we needed really to have our hair cut, and we needed to have, as you can see there, the husband at the top there, to have the beard shaved as well, so that the masks could fit properly. And there I was watching the door. So I managed to sort that out a few times. And somehow, I don't know really how it happens, because I'm really a very good girl, and people kind of people never came up to me to try and offer funny things to me. But here suddenly I became this I hear you are the one to ask person. So if you wanted stickers for some file or something, then you'd ask me. If you wanted sugar, I could give it. I could get it to use. I mean, it's silly examples, but just to give you an idea. But then socially, of course, childcare was an issue, because here both of us at the hospital, boys are 11 and 12 years old. They're alone at home. This is now level 5 lockdown, when we couldn't have anyone else in the house. And I had to just believe that they wouldn't burn themselves with boiling water when they learned to do their own 2-minute noodles. But then there are some of my other colleagues, like Usha, for example, who has the toddler. So I was very worried about that as well. And we attempted to get some form of childcare facility off the ground, and Prof. Musa was very instrumental in that. But unfortunately, due to this level 5 lockdown and the situation that we were in, we just could not get that off the ground. So what happened is we went to the students who were volunteering, and we asked them if they would be babysitters. So that brings me to the student volunteers, because I was also asked by Prof. Musa to oversee the student volunteers. I met 3 amazing and wonderfully talented medical students who had initiated this effort. And the one was Lunay Smith, Smith from 5th year, Sarah Marie Berger 4th year, and Abdul Aziz 4th year. And this whole process kept me very busy. So what were included there in the was included there in the actions, the student volunteer actions, the call center, which had to be manned 24 hours a day, the contact tracing pods, which were just absolutely amazing, I must tell you. We arranged a space for them where they could walk, where they had access to phones, and this was just the stories they told me were just absolutely fascinating. Then entrance 5 testing centers, we had obviously more of the senior students involved there, and had very good feedback from the doctors and the sisters there. Then we had some students assisting in administrative duties at virology, also at epidemiology, and then we had a lot of students assisting with data capturing. I personally assisted with it as well from home, sat in front of my computer for many hours, which was actually quite interesting in the end. Then the door screening was a initiative that we really tried very, very hard to get off the ground. But Tygerberg Hospital had 4 open entrances at that time, and staffing that 24 hours a day was very, very difficult. And we managed it for a while with the students. The students were a little bit scared of the doctors, and because some of the doctors were giving them a little bit of grief. But so they were trying very hard, but in the end we couldn't continue with that. Just the interesting story is there at the top, love in COVID, because the two there at the top, that was the only way that they actually got to see each other. So when they actually did the door screening together. So then we had to, other type of things suddenly became a problem, because now suddenly we realized that here we have all of these students who needed permits, but no one knew who they belonged to. So who was responsible for them? Was it the university? Was it the hospital? No one really knew. And really, I mean, as you remember, everything came in quite a bit of a rush at the end. So in the end, we just had to do what we had to do and give them permits. And you can see someone else sitting there, a well-known consultant sitting there again, signing 350 permits one afternoon. And of course, we replaced it with the proper permits later, but these students managed to get to the hospital with those permits at that time. So I burnt my fingers on social media. I won't go into it, please. But it created a lot of awareness of the needs of our frontline healthcare workers at Tygerberg Hospital. This led to multiple donations, smaller, larger, edible, non-edible. The edible ones I decided to ration, because I know what happens when you drop off everything at the same time. Everything will be finished within, a day or two, if that long. So, and I didn't know how long we'd have to ration this for. I also met this NGO, Soaring Sparrows, who asked the community for donations, baby blankets. It was just absolutely amazing. Also, they actually donated 10 of those thermometers there as well. Here you can see some of the donations. We had a whole lot of rusks, because I thought that was a good thing, something that would last. We had a whole lot of coffee donated, sugar, teas, etc., etc. But then we also had this company who wanted to donate a ton of coffee. So we didn't know what a ton of coffee looked like. So we settled for a boot full of coffee, and I still have some of that coffee that I still hand out to the various clinical areas. As the needs became known, we addressed those. People from the Kangaroo Mother Care Ward asked us whether we could help, because the moms were stuck in there as well. They couldn't go home with their little babies, and so we got a whole lot of these donations. We also got a whole lot of toiletries from corporate and private for the KMC moms, because as we said, they were stuck there. And then we had this amazing initiative that Lune Smith actually started, and it's called We Fight Back COVID. You can see a whole lot of that information on Facebook as well. One of the aspects of that was the ward warriors, and you can see there that on the left, those pink lines are actually, so they managed to get 80 toothbrushes, 80 toothpaste, 80. So they basically, packed these little boxes, as you can see there at the bottom, and there at the top is where they handed it out. The occupational therapy students also helped us a lot with making these little booklets that the that the moms could use to try and keep them busy, you know, how just put your child's footprint there and those type of things that mommies like to do. Then this was one of the other aspects of that was the masking it. This was a huge aspect as well. The lady there on the left made a whole lot of material available at a very low price. Very, very well, a good price. And then all of the students started, and you can see some of the masks over there, cloth masks. And then this was from the Facebook page. So they were very, very creative with all of that. And they asked for, on there, they asked anyone to help who maybe had access to needle or to sewing machines. And then we were also granted access to the sewing machines, as you can see there at the bottom in the kind of in the just off the middle, the sewing machines in the occupational therapy department. So they work there for hours and hours. And that actually, because they were able to make those masks on a Friday afternoon very late, we were at the Friday afternoon very late, pediatrics asked us, you know, they were looking for, I think it was 130 or something like that masks, very like urgently they were looking for it, and we could deliver it because it was already being made. It was going to go elsewhere, but then of course they needed it, and so they just started making more masks. Then another aspect was then Spacers for Hope as well, where Heike Geduld also played a very important role. This is one of the things that she initiated, actually. So we started collecting bottles, and the students started making plans and how are we going to change this into spacers. So like in the olden days, those type of spacers, because of course we didn't want to didn't want to nebulize these patients. And we have to keep in mind that we're not just talking about Tygerberg Hospital. We're talking about all the emergency services in the area, you know, in the province. They also needed spacers, and because of this being winter and all. So we had donations as well, bottles over there. And then it was delivered by the emergency medical services. It was distributed in that way. You can also see a lot of the DAISY project donating finances there as well, so that the students could make visors for Bremer. So I'll talk about the visors now as well. This was also a wonderful aspect, the Corona curriculum. So they, on this Facebook page, they created all of this information that was just fantastic, and all of these videos as well. There at the top on the right, you can see how to wash your hands. Left, how to make a mask. And then Commander Moodley also helped a lot with this, the one on the bottom on the right. So who gets a ventilator and who doesn't, you know, the ethical dilemmas about that. Next part was then the Victory visors. So they started in the orthopedic department. They have there at the tea room, they have a 3D printer. And this 3D printer was then put into use to produce these visors. And as they understood the dimensions and what was required, the engineering department, Stellenbosch main campus, also started helping. They had 4 3D printers, and then even private people also started helping. And there you can see Lene cutting the visor there. And then these, and this is, and I hope this orthopedic surgeon is not on this forum here now, because I really can't remember his name. He's a lovely guy and he's very, very good at that. But here you can see the students coming in weekends, and they were printing and they were cutting, and it was wonderful. And I even got my purple ones because purple is my color. So, but then the lectures restarted. And many students couldn't afford to stay around campus anymore, because we have to realize that very often, or many of these students had to pay for, or themselves or their parents had to pay for the hostels as well as private accommodation, because of course they couldn't stay in the hostels. So they had to go home. If it wasn't for that, I'm sure that this would still be ongoing, actually. It was really, really, I mean, there were wonderful articles published in the media, and that's wonderful that these kids were recognized. I'm sorry, I call them kids, but that these young people were recognized for what they did. Then we had this situation where we had these calls to shut down Tygerberg Hospital, and of course the kitchen was closed overnight, which led to a whole lot of, I mean, we were running around to try and get some food organized for our patients. So Andre Nyokia's wife arranged this this from one of the local spas where at least our patients in the ICU had this food, and Feed'em donated soup and bread, and I took a whole lot of rusk so that they could get a rusk at least in the morning. And here you can see some of the food that the registrars and the consultants in the ICU actually brought. So they really banded together to try and really look after our patients. We had some more donations, non-edible ones, as you can see here. Boxes stacked up in my house that I brought through to the hospital. So Environ donated some moisturizing creams to try and help our stressed and tired skins. And then we had some more donations, and actually this still is ongoing. There you can see some muffins over there, and then this Cook Sisters were actually, I think, on Tuesday, wasn't it? And then we had some donuts, and I bring pancakes regularly. And then this also is still ongoing. So I get a phone call every so often to say that there are more little knitted things that I have to come and pick up, and I take it upstairs to Lizelle van Wyk, and she distributes it at the pediatric wards. So in the meantime, this is now my house. So the rain spiders started to determine the routes that we could take through the house, because Daddy wasn't there to catch them and to redistribute them outside. And I'm still hopeful that my boys will make it through this year unscathed, and that they will actually pass the year. And so I learned a lot. I met a whole lot of wonderful people. Yes, so thank you for the opportunity.
Thank you very much, Sarita. Okay, we out of time. I just wondered if I think if on this meeting, if you would like to say something.
Sharon, may I?
Yes, thanks, Rafiq. That would be great. Thank you very much.
Well, I think what you've seen is a showcase of some of the women in the Department of Medicine and in the faculty. And all I can say that I'm bursting with pride, to be working with women like these. I think I think I've been aware of the contribution that they've actually made, but the extent of the contribution, also the sacrifices they've made, has been an eye opener for me. I think we are really very grateful to all of them for what they have done and what they are continuing to do. I think we also need to remember that the fight isn't over, and that COVID will be with us for quite a long time. But I think between them, they've undoubtedly made a huge contribution to our community and undoubtedly saved an enormous number of lives. So Sarita, Nonti, Usha, Nadia, thank you very much for everything that you've done. There are one or two ladies that have not presented, and I really do need to mention them, and that's Roshni, who's the medical manager, and she's an absolute star. I'm not quite sure whether she's on this forum, but she's been absolutely amazing, and I think I think one of you did mention her name, but she's been absolutely amazing, and I think without her input, we probably wouldn't have been achieved quite what we have. And then perhaps the other person, woman that has really made a big contribution has been Marley, and she has been taken over. She was not involved directly with the COVID, but she took over the non-COVID side, the low-risk side. And again, without her contribution, the department would really have struggled. So, I take my hat off to you, to all of you ladies, and thank you from the bottom of my heart, not only on behalf of the department, but I think the faculty and also our community for everything that you've done and all the sacrifices that you've made. You are absolutely amazing, and I don't think that words can really express the gratitude that we have to you and all the women. I think in the department, in the faculty, who've made this COVID response the success that it is. Thank you very much.
Thank you very much, Rafiq. I think Marley, did you have your hand up?
I did have my hand up. I thought just to say in 2 minutes, that I would like to reiterate everything that my dear colleagues have said. I think that it's been a phenomenal response, and that the woman has made a huge difference in this COVID response. Just 2 points that I think I'll just maybe add on, and that is that I think we as women have all learned to appreciate the small things in life, important things like a hug, a visit to family, seeing your parents. I haven't seen my parents in February either. And that we will, going forward, keep on appreciating that once we have now survived this. And the second point is, well, that we're going to appreciate things. And the second point is that I think a few good things have come out of this. I mean, if anyone said in February that we'll be having a virtual meeting as we are having now, I think a few of us would have shook our heads and said, there's no way. So I think a lot of us have upped our technological skills. I have upped my cooking skills. Usha, I'm one of the moms who started baking chicken pie and made kimchi because I couldn't get that in the midst of level 5 lockdown. So a few skills and good things I think is going to come out of this going forward. My daughter, just as a last point, my daughter gave an oral on Teams, I must say, when they were still having Teams school as well. And she gave the oral about me as well. She called it the unsung hero. And I was rather put to tears when her and her dad actually put the oral together, and when she presented it to me the one day, I just burst out in tears. So I think we as women can be really proud.
Thank you, Marilee. There've been wonderful comments in the chat as well, so thank you very much for those comments. I'm going to hand over to Professor Moodley to close the session, and again, thank you very much for the honor of being able to chair it, Kimantri.
Thank you very much, Sharon. Thank you for chairing the session. Thank you to all our wonderful speakers for sharing so generously with us and for your sincerity and authenticity. You've learned valuable lessons, and now we've all also learned them with you. Thank you to Prof. Volmink, our Dean, who's joined us throughout the last hour and a half. We're way over time. And Prof. Volmink, if you'd like to say a few words, I'm going to hand over to you quickly.
Thank you, Prof. Moodley. I'm still sitting here and I'm taking it all in, and I'm digesting what I've heard, and it's been so moving. And I really just want to echo what has already been said, that, you know, at some level, one knows that people are, you know, very committed, people are making sacrifices, people are working hard, people are trying to juggle, but just to hear it firsthand, I think, from all the presenters today, and just trying to imagine what people have been going through and are still going through, I think it's just filled me with such renewed appreciation for the work that you do. So, Commander, I just want to say thank you for setting this up, and to everyone involved in this fight. You are absolutely amazing warriors, and society offers you a great debt of gratitude. Thank you.
So thank you very much, Prof. Volmink. Our sincere appreciation to all our speakers and to all the Women's Forum members, and for everyone who joined us today, men and women alike. Thank you so much, and I hope we will have a meeting in person next year. Keep well and stay safe.
Thanks, Commentary.